When taking an office blood pressure measurement using a manual cuff, you have several cuffs to choose from. You want to select the cuff that is most appropriate for the patient. Using the guides on the cuffs themselves will provide you the most accurate measurement. So we're going to select the cuff, roll up the patient's sleeve so it's non-restrictive. If it's too tight and restrictive, then you're going to ask the patient to remove their arm from the sleeve. You're going to size the cuff up, placing the index over the brachial artery. Roll it onto their arm so that it's snug. We can see here the line falls between the markings. You're going to check placement and make sure you can fit 2 fingers underneath the cuff so that it's not too tight. We're going to make sure the patient is not talking on their phone or using their smartphone device to read any emails. We want to make sure we are not speaking to the patient and the patient's not speaking to us. We want to make sure the patient is positioned properly with their feet flat on the ground, their back supported, their legs uncrossed, and their arms supported on a surface. We also want to make sure the patient has emptied their bladder and also want to make sure they have rested for 5 minutes. We'll set up the cuff and attach it per manufacturer's directions. You're going to have your stethoscope in your ears ready to go. You're going to palpate for the patient's radial pulse. And you're going to begin to pump up the sphygmomanometer. Once you obliterate the pulse, you will pump up an additional 30 millimeters of mercury. When you've done so, you'll take your stethoscope, place it on the brachial pulse, and deflate your cuff at 2 millimeters of mercury per second. The first sound you hear is carot cough sound 1. That'll be your systolic blood pressure. The last sound you hear will be carot cough 5, and that is your diastolic blood pressure. Once you've completed the reading, remove the cuff from your patient and document the measurement. When taking a blood pressure using an automated office blood pressure device, you want to have your patient positioned with their feet flat on the ground, their knees uncrossed, their arms supported on a table, and their back supported on the chair. We want to make sure they've emptied their bladder and have had a 5-minute rest period. We're going to place the blood pressure cuff on a bare arm using upper arm only, ensuring the sleeve does not constrict the arm. If it does, we'll ask the patient to remove their shirt or jacket. We're going to make sure we select the proper cuff size using the markings on the cuff. We're going to place, per manufacturer's directions, the marking over the artery, and then we're going to make sure the index falls between the white lines on the cuff. We're going to have the patient relax for 5 minutes, and then we'll press the start button on the machine and begin the blood pressure reading. When the machine is done, we're going to document our systolic and diastolic blood pressures. Remove the cuff. And notify the provider the patient is ready.